Hello everyone, welcome back to our channel, and for today's video, another important concept under your community health nursing, one of the subspecial field of community health nursing in the Philippines, your occupational health nursing. Before we proceed to the actual discussion, once again, my name is Joel Cruz Pascua, and if you are not yet a subscriber of this channel, don't forget to subscribe, hit the like button, and comment your suggestions and questions sa ating comments section. And don't forget to share this video to your classmates or friends. For occupational health nursing in the Philippines, this is defined by the book as the autonomous practice requiring independent decision, creative solution to complex occupational and environmental health and safety problems. That is why your occupational health nursing is also known as your industrial nursing or industrial health nursing. So basically, this is the practice of your nursing process in the institutions requiring occupational health nurse or occupational safety officer. So that is your occupational health nursing. So the focus of this practice, okay, is the preservation and the restoration of the working population. Comparing now to the school nursing, your occupational health nursing focuses naman po sa working population. That includes the employee together with the bosses and all the employee or personnel working in an institution. So as you can see, the word there, the focus is still the preservation and restoration, because occupational health nursing is a subspecial field of community health nursing. That is why the focus is almost the same. The only difference is that it focuses on the working population, just like it's written there in our slide. Now, the legal basis of occupational health nursing in the Philippines is under Presidential Decree 856. This is also known as your Sanitation Code of the Philippines, wherein under this law, okay, it requires now all company, okay, to have an occupational safety officers, okay, that would determine possible hazards or safety problems that are present in a certain institution or company. Okay, that is your occupational health nursing. Now, another important concept under your occupational health nursing are the 10 essential components of occupational health. These components includes number one, health promotion and prevention principles. It is always there. Okay, we want to prevent injuries. We want to prevent accidents to occur within the company. Okay, that is why our focus, or one of the focus, or one of the essential components that we need to implement is health promotion and prevention principles. So if you will be working as an occupational health nurse, you have to establish programs that would minimize, if not eliminate, the risk of the employees to acquire accidents or to acquire any injuries during their job. Okay. Another essential component is worker and workplace health hazard assessment and surveillance. Part of this is that the company should have a risk reduction assessment program wherein a group of people within the company, as part of the working health team, will need to monitor and find out if there are any factors that can contribute to the development of accidents or any work related injury within the company. Okay, and they need to create a plan, okay, to prevent this possible injuries or accident to occur. Okay, another one is injury and illness investigation, analysis, and prevention. This is if in case, okay, if in case that an accident or an illness occurred within the company, okay, that is during the line of work, they have to investigate if this is something that that is contagious. For example, if it's a communicable disease, if you are working in a company that is handling viruses or live microorganisms. Okay, and injury if you are working in a company that requires machine operations. Okay, things like that. So they have to investigate. Okay, investigate and analyze things in order for this to be prevented in the near future para hindi na po maulit kung nangyari na. Another component is primary care. Of course, primary care means that you have to take care of the employee if in case that they have suffered from injuries injury or work related injuries or work related illnesses. So you have to provide primary care to them, okay, or first aid treatment, and if it needs referral, you need to refer them to a higher level of healthcare facility. Okay. Another one is case management. Case management includes a specific condition that occurs within the company that is accident, incident, or illness related. So you have to manage them accordingly. Another one, counseling. If in case that the condition of the patient or the condition of the employee is somewhat related psychosocial. Remember, if you have watched my previous video about school nursing, our focus in terms of the definition of your health according to World Health Organization, we are not only going to focus sa presence ng disease or illnesses, we are not going to focus only on the physical aspects of care, but we also need to focus on the mental aspect and psychosocial aspect of the of our working populace. Okay, so that's your counseling. So we need to provide counseling with them for them. Management and administration, because you will be working with teams as well. Legal and ethical monitoring. So with regards to legal and ethical monitoring, there are some hazards, okay, in the company or in the institutions that requires you to consider the legality and ethicality of the based on standards. Okay, mamaya pagdating natin sa types of hazards, I'm going to give examples of that or of this one. Okay, research is also been one of the essential components of occupational health, because by doing so, you'll be able to come up with a strategy that would minimize or prevent the occurrence of future accidents or health related conditions that might occur within the company that is work related. Okay, so kadalasan po it's a product or a byproduct of research or case analysis. Okay, and the last one is community orientation. So community orientation, since when we try to define community, it's a group of people with common norms or culture. So basically, the working population within a certain company or institution is considered as a community. So we have to define, we have to make guidelines in order for the people within the particular community, in this case the company or institution, para may susundan po silang guidelines. Okay? So those are the 10 essential components of occupational health, occupational health in terms of the practice, okay, sa ating community. Now, uh, workplace hazards are categorized in 5 category. Okay? So, depende na lang po sa company kung saan ka nagtatrabaho. These are some workplace hazards that you might encounter and that you should be aware of if you will become an occupational health nurse in the future. Number one is the physical hazards. When we talk about physical hazards, this refers now to the following, such as your radiation, temperature or extreme temperatures, noise, electric and magnetic fields, lasers, microwaves, and vibrations. So if you are working in a company that there is a possible exposure to these types of or categories of physical hazards, okay, such as your radiation, extreme temperature, electric, magnetic fields, laser, microwaves, and vibration, as the company's occupational nurse, you have to gain knowledge about these conditions or these situations. What are the possible incidents or accidents that may occur, or okay, or health related issues that may develop due to exposures of these physical hazards. Therefore, you have to come up with a plan also para matarget, okay, or mag-come up ka ng mga first aid treatment or health regulations that will be part of your guidelines if you will be working in such institutions that are exposed to physical hazards, such as the following. Another category is the chemical hazards. So same is true. Okay, if you will be exposed to these chemical substances, you have to come up with the possible guidelines that you need to follow in case an accident may occur. Okay, or will occur. So, kailangan magkaroon ka ng anticipation kung ano yung mga possible accident na pwedeng mangyari in relation to the work environment that you and the employees has. Okay, kasi kapag pasok mo naman sa isang kumpanya, alam mo na kung ano yung line of company nila, alam mo na rin kung ano yung mga possible danger na pwede mong ma-encounter. So, chemical hazards includes your solutions, mist, vapors, aerosols, gases, medications, solvents, metals, and your oil. So, all of these are actually chemical hazards under these categories. Okay. Another one is your biological hazards. So biological hazards are referring now to biological organisms that can cause health conditions to the employees. So these biological hazards includes your viruses, your bacteria, your fungi, your molds, your parasites. So as you can see, these are the disease-causing microorganisms. And if we try to relate it to the ongoing pandemic right now, like for example, the virus, there are some theories that the condition actually came from a laboratory in China, but the fact about that, it still needs to confirm. But that is an example of biological hazards that we have. Okay. Another one is your mechanical hazards. I'm sorry, the letters are not changing, but it's letter D. Mechanical hazards. Mechanical hazards includes your machine-related accidents and injuries. Okay, so with regards to this one, still you need to plan ahead of time since you are exposed to this type of categories, okay, types of categories of workplace hazard. Then you have to come up with the guidelines and plan that would suit the possible accidents or incidents that may occur within the company where you are working to. Okay, and the last one is your psychosocial hazards. So psychosocial hazards, just like the definition of the World Health Organization, health will not only focus on the physical aspect and in the presence or not presence of a disease. So it also focuses on the mental aspect and psychosocial aspect of an individual. So in line with this, okay, we also need to take note of the possible categories of workplace hazards such as your interpersonal conflict. So these are between employees or even your employer. Unsafe working conditions. So kapag may mga unsafe practices doon sa company. Another one, overtime, especially if it's unpaid. Usong-uso po yan sa Pilipinas. Pag late ka, walang bayad. Okay? Or kakalasan ka. Pero pag overtime, okay, walang bayad. Okay? So laging pro bono. Sexual harassment, commonly occurring. Okay? Kahit commonly nangyayari sa mga babae but also happens to men, okay, in some institutions. And of course, your racial inequality sa Pilipinas, it also happens, okay, especially that very wide ang ating cultural background, but commonly nangyayari ito in the Western countries, okay, your racial inequalities. And your role conflict, okay, okay, role conflict is also included under your psychosocial hazard. So what I've said, one of the elements earlier is the ethical and legal principles. Then this will the ethical and legal principles will come in here, okay, especially sa sexual harassment. Kadalasan kasi nangyayari ang sexual harassment through yung coercive power na meron ang isang employer. Okay, so ma masusubukan yung iyong ethical standard belief, okay, kung susolusyonan mo ba ito, are you willing to call off the employer who hired you na nagko-commit ng such crime, okay, or such hazards. Okay, so those are your 5 categories of workplace hazards that we need to take note. Okay, and there are instances that all these 5 categories are present in one institution, then therefore you have to come up, okay, come up with the guidelines or protocol that you need to follow, okay, if in case one of these hazards or a few of these hazards occur, okay, within the company when where you are assigned. Okay, now what are the general key concepts that we need to remember in terms of your occupational health nursing? Okay, according to our book, The Public Health Nursing in the Philippines, men, self-employed, and older workers are more at risk of occurring illness or injuries at work. Okay, that's according to studies as well. Occupational injury rate is higher for mid-sized organization compared to a higher size organization. Okay, highway accidents and homicides are the most common cause of fatal work injuries, which is true, especially also in the Philippines. Okay, another one is your occupational injuries are more common than occupational illnesses, which is correct. Mas maraming nangyaring accidents sa mga line of work kaysa mga sakit. Okay, unless your company is something that's related with biological hazards. Okay, and the sources of occupational health information are the following agencies: your DOLE, NSC, your ECC, and your DOH, non-communicable disease prevention control department. So those are the key concept that is related under your occupational health nurse. Again, if you do have any questions, don't forget to write your comments sa ating suggestions. We'll try to answer that sa mga next videos natin. And of course, subscribe, hit the like button, comment, and share this video.